Agimfor medication. Detailed information. Agimfor medication contains the active ingredient metformin, a drug belonging to the biguanide group, used to control blood sugar levels in patients with type 2 diabetes. 1. Ingredients. Agimfor medication contains the active ingredient metformin, a drug belonging to the biguanide group, used to control blood sugar levels in patients with type 2 diabetes. 2. Uses blood sugar control. Metformin helps reduce glucose production in the liver, increase insulin sensitivity in muscles, and decrease glucose absorption in the intestines. This helps control blood sugar levels in type 2 diabetic patients. 2. Uses prevention of diabetes complications. Using metformin reduces the risk of developing diabetes complications such as cardiovascular disease, nerve damage, kidney damage, and eye damage. 3. Dosage and administration. The dosage and administration of Agimfor medication are prescribed by a physician based on each patient's condition. Starting dose. Typically, the starting dose is 500 mg DAY, divided into 12 doses. 3. Dosage and administration. Maintenance dose. The maintenance dose can be gradually increased, up to a maximum of 2000 mg DAY, divided into 23 doses. Note: take Agimfor medication after meals to reduce gastrointestinal side effects. Do not stop using Agimfor medication without consulting a doctor. 3. Dosage and administration. Do not change the dosage of the medication on your own. Competition with transport systems in the renal tubules. Metformin can interact with cationic drugs excreted through the renal tubules, increasing their concentration in the blood. This can lead to increased toxicity of these drugs. Some common cationic drugs that can interact with metformin include digoxin, morphine, amiloride, procainamide, ranitidine. Competition with transport systems in the renal tubules. Triamterene, trimethoprim, quinidine, quinine, vancomycin. Increased metformin blood concentration. Cimetidine can increase the peak concentration of metformin in plasma and whole blood by up to 60. Therefore, avoid using metformin in combination with cimetidine. Note: increased metformin blood concentration. Report to your doctor all the medications you are using, including prescription drugs, over-the-counter drugs, vitamins, herbs, and dietary supplements. Do not use any medication without your doctor's consent. 5. Side effects. Common diarrhea, nausea, vomiting, abdominal pain, loss of appetite. Uncommon rash, itching, headache, dizziness, fatigue. Rare hepatitis, thrombocytopenia, renal failure, lactic acidosis. Note: report any side effects to your doctor or pharmacist. 6. Contraindications. People with severe renal insufficiency, people with severe liver disease, people with lactic acidosis, people with congestive heart failure, people with chronic obstructive pulmonary disease, people with severe anemia. 6. Contraindications. People with allergies to metformin or any other ingredient in the medication. Note: inform your doctor about any medical conditions you have before using Agimfor medication. 7. Storage time. 24 months from the date of manufacture. Storage conditions. Store Agimfor medication in a dry place, avoiding moisture, heat, and direct sunlight. Suitable temperature is from 20 to 30 degrees Celsius. Note: keep Agimfor medication out of the reach of children. Note: 7. Storage. This is all the information about Agimfor medication. Patients should carefully read the instructions for use and consult a doctor-pharmacist before using it. Do not use Agimfor medication without your doctor's consent. Always follow your doctor's instructions regarding dosage and administration. 7. Storage. If you have any questions about Agimfor medication, contact your doctor or pharmacist for advice.